My name's Louise Atkinson, but prefer to be known as Lou. I live in Mapoon, which is 70 k's north of Weipa, up in the Cape. Been living in Mapoon since 1993. Started in health in 2004, and still there.
My name is Shane Lee Walker. I'm from Hopevale originally. I live in Cairns. I work at Apunipima as a communication assistant. We're a health organisation. We help the communities up in the Cape. We service 11 communities. Apunipima means all united in one. I have one son. I received the baby basket in 2009. Yeah, I had my little boy in 2010, and I received 3 baby baskets. When you're a first-time mum, you freak out. You don't know what to expect.
My name's Dr. Jackie Meehan. I'm the Senior Medical Officer of Apunipima Cape York Health Council, based in Cairns, and we service the Cape. We're interested in doing a video evaluation because we want to make the program stronger.
Good, how are you?
A lot of people see this program as just a handout, but we see it as so much more than that. It's about really leaving people with learning. So I see the baby basket as an engagement tool. I see it as an opportunity so that a relationship can be established between a woman with a baby coming and with a health worker or a nurse or a team, so that they can actually leave that woman with some great starts for that baby.
So Caroline, this is your baby basket too, that we give to you before you go to Cairns. You have Baba. There you go. No worries, see ya. The 2 communities that we interviewed that I went on was Mapoon and Mossman Gorge.
The service before, when I first came here in relation to maternal and child health, it really was non-existent. So what happens now, we get a maternal and child health nurse/midwife from Apunipima, comes out to Mapoon every fortnight, and she then works with the Indigenous health worker from this community. But the other good thing about this program is that it's health worker led.
This is the first baby basket. Kiri and I are going to go through the content. When you're jumping on the plane, this is a travelling kit. Everything on it, in it, could be taken on the plane as well. That's when you're going down for your first scan. You want to say that one?
A lot of the mums are first-time mums here, and young ones at that. And I think with the education that goes around the baby basket, also gives an opportunity for the parent or the mum and the dad to actually ask more questions and, try and support them when they're home with first baby.
For my first one, it was a bit of a shock because it was actually hasn't settled in that I was having a baby. So, and being so young, it was like, yeah, Kiri, it's real. The only person I had was my partner, and it was the first time experience for him too. I received the first basket and it was something new to me. I didn't know that there was baskets provided, and we had vouchers as well. And first I was starting to freak out because I was like, I'm still getting to know that I'm having a baby. So, and I found it really helpful because like the first one, it was just more or less talking about how the trimesters go through and stuff like that. The second one I got before I had him, that helped a lot because I kind of was confused about what to do. But I brought some stuff myself, but having the baby basket helped a lot because there's stuff that I did forget, and at the time I had him, it wasn't payday, so it was like, oh, bit stuck. Well, the midwife had came up. Back then it was like once a month. Well, when we received the baskets, she actually explained what stuff was in there, even explaining about iron tablets, and she was just giving, it basically had everything there that I might have had questions to. So they were my answers. But I felt great because it helped a lot and made me feel I'm okay because I've got something there that's supported me.
I have 5 children. My oldest is 12 years old and my youngest is 2 years old. My youngest one is the one that I did the baby basket for, that's Kylie. She's now 2 years old. I think it's harder to have a baby remotely than in Cairns, because in Cairns if you get sick or if you can just go to a hospital in there. And I know with my last bub, compared to the other bubs, I had complications. So yeah, and then you got to get flown out, then flown back in if you need to go out for complications or anything like that. And not being able to be in your home and being comfortable when you have to have your baby. I struggled when I went down to have Kylie because 4 weeks away from my house, 4 weeks away from my other children. Yeah. I remember getting a bag. I remember getting a baby bath, and then I bought a bag, a hospital bag, with a lot of goodies inside of it. Yeah, and I got fruit and veggie vouchers from Apunipima every month. I was happy actually. It was helpful, and I was happy that they were helping me out, getting some stuff, and it was things that I didn't have to go and buy myself. I remember. Yeah, I was excited.
My name's Baressa Fraser. I'm from Arakoon, but I live in Old Mapoon, and this is my baby Jackson. My son is 16, my oldest son, and my experience from when he was a baby and the experience that I've got with him is so different. Living in Mapoon, I've had a lot more support during my pregnancy and with him now.
Oh, what's that? Oh. Right. Oh, that's nice. What's that?
Yes, so I think the baby baskets were really helpful in terms of having things. Sometimes you don't always think of everything to have for when you're going into hospital. So it was just good to have those things there already. And I know coming from the Cape and then going to Cairns, it was just easy to, rather than trying to go shopping while you're almost due to have your baby, and having those things was helpful. And you can just put some of those things straight into your bag and take it with you into the hospital.
We usually carry the bags with us and sit one-on-one with them and go through what's in it. And when they go to Cairns, they receive a second baby basket, much larger, with clothes and stuff in it. So, they're not left alone. There's always someone there to meet them.
Having another Aboriginal person was really helpful. And I think it's just makes you feel more comfortable too.
Well, from my experience working mainly around children, I just love it. Like, I love meeting mums and I love meeting new babies. Yes, it's just a good feeling out here, with parents. Having this baby basket is a good product, because you're actually opening up that bond between yourself and them, and they're actually putting their trust in, they're trusting you,
I found everything really useful in the packs, and as I said, I'm still using those things, and I feel really lucky that, Jackson was able to receive those things, and really grateful for the support.
Strong against the waves you stay, anchored to the shore. Tides have swept away, you remain. Strength at our core, shine in your light.
Mossman Gorge is a beautiful country. We have a running fresh river just at the back of my backyard. Lovely cold river to swim in. Hi, I'm Katrina Douglas. I'm from Mossman Gorge. I'm still residing here. I lived here most of my life, and I'm 32 years old. I'm a single mother of two. My son is 12 years old, and my daughter's 8 months. The baby basket was more convenient for me because I could save up money, and employees from Apunipima were kind and friendly, and they recommend that we should have that for our little ones, and I recommend that it's best for all mothers to have it. The voucher was useful. I could go into Woolies and get the veggies that I really needed for my health and for Bub. I wouldn't change it for anything else. I'd be happy to stick to whatever Apunipima had for each mother's. Plus, it makes you feel special too as a mum when you bring in your child into the world. The antenatal care was really good too as well. The nurse were really professional and friendly and caring. Our health workers, whenever I need help and support, they come around and see me and Bub, which is very convenient, and yeah, I'm happy with the service that they provide for us. So they work with us professionally, and they keep everything confidential. Most of them are all Indigenous, so it's really comfortable for me to work with them. It's all about trust and everything. Yeah, that's helpful for me and my family. And plus, this pregnancy I was a lot healthier with Zaina because I gave up drinking and I gave up smoking. I think because I learned from my mistakes when I had my eldest one, and I was drinking a lot. So as I got older, I realised that having another one, it was my responsibility, and I want to be a better mother. So I had to change it within myself, and I had a really professional, good counsellor that helped me through the rough times that I was going through. So all mums deserve a second chance with their children, no matter what situation that they're going through. So I really want to share that.
Usually when we introduce the baskets, it is during their antenatal care and getting them linked in with education and caring for themselves and their babies. Then throughout the program you've got a baby basket too, which is preparing them for having baby, and you're doing that one-on-one support with them. Because we can't access a lot of antenatal classes for them to tap into in communities, it's our way of giving them that home visiting and one-on-one support where they feel comfortable and supported. And then when they have their babies and they come back into community, we're still supporting them, with their third basket, encouraging breastfeeding and what.
And it's
what
great too, the
yeah.
opportunities for education, isn't it?
Yeah.
You've got the soap, the shampoo, the toothbrushes.
Yep.
The baby basket, which is SIDS friendly.
Yep.
It breathes through its nose and down this way.
Indigenous women, especially if they come from up the Cape, they often don't have the resources to buy the stuff that they need to go to hospital. So it's fantastic, as far as I'm concerned, it's a fantastic resource so that Indigenous woman presents at that hospital with everything she needs for that baby.
And herself.
And herself. And it just makes them feel so much better.
It's working because the women are, coming back and asking about the program. Our numbers are nice and high because their visits are nice, coming back. And the babies are...
they're just
the
benefiting.
outcomes of the babies is that they're coming back to, they're thriving.
They are.
They're thriving from just all that education and support.
Oh, look at this. I love your dress.
Hello, my name is Eileen Miller. I live in Mossman Gorge community. I have 2 children, Daryl and Cephas. Daryl is 4 and Cephas is 8 months. At the moment it's wet season, so everything is all wet for a good couple of weeks.
My name is Angelina Ross Kelly, and I live in a community. Been living here for most of my life. Part of the Kugialanji tribe. I got 2 children, 2 daughters.
Apunipima is really good because they always make sure if you're alright. They hold events for us. They give out a lot of incentives, a lot of things. Really good with the awareness of all the sicknesses that go around. The baby baskets were good, so they went through it with me. There were like 3 ladies at that time, and they explained everything and they asked if I understood and all of that kind of stuff, and yeah, they made it really clear. It was kind of exciting too because there's all this stuff in the bag and you're just like, hey, what's this and what's that, and yeah, like me and my partner, we were going through and looking at everything, and yeah, no, it was exciting, yeah.
Same thing as Eileen said. Me and my partner were going through all them too, and just couldn't wait any longer then for a baby to be born, holding all the little small clothes and the little nappies and all that there.
Having children are a blessing. It's wonderful. It's a very long journey till the day that you die, pretty much. But it's beautiful, and enjoy it while you can, because they're not going to be around forever, little babies.
So this is where we store our baby basket 1s, and then baby basket 2s are down here. We have less of those made up at the moment because they're very large and they take a fair bit of time, so they're a bit more made on needs basis. And then here's our stockpile of baby basket 3s. And the best part about this is that you can put it on your back and walk like this, or you can wear it like this. And I often see the dads in community going fishing with their baby basket 3 on their back, like this. Ready? So I'm going to stand up. Okay, ready? Walking, 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 hop, 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 running, running, running.
I think one of the really positive joys of the babies, of mums having babies here, is the way that they are welcomed into the family so fully. It's very inclusive, and I think the babies are very loved and very nurtured by their whole family.
I'm Jo, and I'm working on helping evaluate the baby baskets, and we're looking through what's in baby basket 2 and seeing what the mums like to use best out of it.
Lavinia gave me baby basket and I was like too excited. Yeah, when I see that baby basket, and when I was seeing like something inside, I was there and felt like baby things here at the shop or store.
Well, definitely the shop situations up here.
So not having the availability to fresh fruit and vegetables all the time, and the price, like the costing of the price, and like there's not really a much of a maternity range or baby range here. Like you can't buy baby singlets. Like I had my first son in Cairns and they didn't have the baby basket at that time. So you didn't have, like you had to go out of your way and save money and get all your fruit and veg by yourself. Whereas with my second one, I felt the pregnancy went a lot better than the first one. Just having that more of like a support.
I've got 4 children, but Zoe's my last, and I call her my surprise baby. Wasn't expecting her, but she's here. And with the baby basket, I didn't know of the baby basket until I was at the clinic getting myself checked. And Lisa, one of the child health nurses that was there before, introduced me to the baby basket and was telling me about that. And I was like, wow, this is good for a start. And just getting that was like, yeah, made me feel good that I was getting something. I think it is a useful program, and I think, especially first-time mums, you know, if they don't have that help from their other family members, it would be something that they could benefit from. You know, not just for their babies, but for themselves too, making them feel good, and that someone's out there looking after them.
I'm a mother of 4 kids. There I received 3 baby baskets. Some of the stuff's in there, but the store didn't have on shelf. And when we did run out, at least we had the bag to like washers, bit of Kimby's, first aid kit. Veggies and fruit up here not really cheap, so the $40 it did help, because I used to crave for especially peaches, and yeah, so I'd go up to the hospital just to get the voucher to go and get 2 bags of peaches.
Yeah, a lot of it's that expectation of what the mothers have to do for me, so it's nice to be able to give them something, and apart from just information, to actually give them something that goes with that information that they can use and it'll be valuable.
I reckon, yeah, it'd be good if fathers get more involved with their partner's pregnancy and checkups. Maybe in the first basket, there should be like mum, dad, and baby as a like congratulation. And I think second, maybe fishing rod at the end of the third basket.
Probably the 90, because it wasn't a button-up one. And I think for breastfeeding, it was nice and comfortable, but for breastfeeding in the hospital, maybe not the best thing.
But I think if more information and stuff were in there for dads, that'd be good, yeah.
Even a DVD of other dads.
Because everything is just about the bubs and the mums and yeah.
Sort of get left out,
Some storybooks, so parents can start reading to the kids maybe at 6 months, reading them to them at bedtime, and just to get them ready for schooling. And I think that's a good opportunity for dads as well. You don't necessarily have to read the book, just looking at the pictures and making up your own stories, also a good thing to do.
Yeah, I think the basket should go on until they're 1. It'd be good if it does, because then they could get little like educational things, and
maybe continuing the fruit and veg vouchers.
One of the few things I do want is hair ties in there. The mothers always want hair ties.
Baby brush pack should have been in there, and toenail clippers for the babies. That's 2 things that would have been missing from there.
Yeah, I guess if there's a mum and a dad, include the dad as well. Make him feel good about himself. that he's included as well. I don't know, things like maybe shaving cream. This is just something, shaving cream or whatever, you know, whatever that person might like.
I've really noticed that these bags and the education that we give with them have made, anecdotally, a huge difference to how these babies are kept.
You're gonna go buy 2 juice.
Just the different stories on what other mums go through. It was touching and it was interesting, and like how the service we bring is just awesome, you know, like to be able to deliver those kind of service up in the Cape. I love working with babies and like especially women, but yeah, going up to Mapun, I was like, nah, I'm going to go and do it. Something I really want to do. I'm going to go and work hard and try and get into that position. And now I'm going to be a health worker. It's a maternal and child health worker. I serve as Kawanyama and Cairns, giving out baby basket, explaining it. And I've always wanted to go and work out in the communities anyway.
Ultimately, we know that with a great start in life, you're going to get good parents growing out of that. It'd be just lovely if we can make that baby basket program redundant in a generation, a bit like closing the gap.
Strong against the waves you stay, anchored to the shore. Tides are swept away, you remain. Strength at our core, shine in your light, you guide lost and broken souls, a watchful love in your light, the way through rocky shores, in crushing tides. You are a beacon in our lives. In rough and ready seas, you